So Health Minister Dr Joe Phaahla has revealed that out of the 118 of the country's state mortuaries, only 62 were awarded certificates of competence. According to retired Chief Specialist of the Gauteng Southern Cluster Forensic Pathology, Professor Jeanine Vellema, now she says conditions at these mortuaries are so poor that it's raised questions around standards against which they are being measured. Now Gauteng is of course home to about a quarter of South Africa's population, and its forensic pathology service compiles 1,500 to 1,800 autopsy reports a month, but they are facing a backlog. So how difficult is it to perform autopsies under these conditions? Well, to unpack this and more, we are joined via video link by Professor Vellema, who is, of course, as I mentioned, a retired Chief Specialist of the Gauteng Southern Cluster for Forensic Pathology. We are also joined by Mr. Vuyisile Mabindisa, who is the General Secretary from the South African Funeral Practitioners Association. Thank you so much to the both of you for joining us for the discussion. Prof, I'm going to let you get your first take here. The news from the Health Minister Dr Joe Phaahla that only 62 of our mortuaries are getting certificates of competence. What does that mean? Are you surprised by that number? Let's start there.
Well, you have to look at what the certificate of competence was for. And this is not a certificate of competence in terms of the quality of the medico-legal services rendered. These are certificates of competence in terms of environmental health and safety standards. So these are things that would look at, for example, refrigeration, occupational hygiene, PPE, and things like that. So in some ways, I think I was misunderstood when I said that these compromise the quality of our medico-legal death investigation services. They do compromise our ability to perform it optimally, but I don't question the quality of the work that our professionals and our support staff render under very, very difficult conditions.
Okay, then let's talk about where we are seeing a challenge and what then those certificates of competence really do look at. We're seeing issues around broken fridges, unhygienic working conditions. How big of a problem is that in our mortuaries? Prof, I'm staying with you for this one.
So it really is a problem. When refrigeration units break down, they're not small units in a service like ours. They can house up to 200 bodies in a particular refrigeration room. So we have a difficulty because where do you move them to? And this obviously leads to undue decomposition of human remains, which we don't want, because that can make it very, very difficult to perform a top quality autopsy, for example, and take specimens for investigation, because these can be degraded if that situation arises. How do you solve it? Well, these are administrative issues which we struggle with in our service because funding in state facilities is always a problem, and there seems to be just such an enormous overload of the various divisions that are supposed to be taking care, for example, and respond to a refrigeration unit that's broken down. And when you're in a high-density province like Gauteng, where we have a quarter of our population living and we do about a quarter of the medico-legal death investigations, if you have fridges breaking down in one of the 11 facilities or 3 simultaneously, then, it's difficult for them to attend, and I can't give you the reasons why, I don't know why entirely, to attend to them as rapidly as they should. And our problem is, where do we move them to when that happens? We don't have alternative, for example, facilities where they can be housed for any extended period of time.
Ultimately, we're talking about the refrigeration of people's family members here. And I'm going to bring you in here, Mr. Mabindisa, because you can talk to me about what the funeral practitioners then are dealing with, and if you've seen concerns even from family members, because when we're hearing that half of our mortuaries are not in the best of conditions and that unhygienic working conditions, waste management is an issue, broken fridges are an issue, that means the state in which people are receiving their family members must be of great concern, right, Mr. Mabindisa?
Yes, correct. That relates to when we receive the bodies from the state mortuaries. But when you're coming to private mortuaries like your undertaker mortuaries, because of we are private mortuaries, we make sure that all our refrigerators are of top notch and they are correct and they are in the good state of preserving the bodies. So obviously that is our value proposition when you talk to the families, that as soon as you get the information that your body is at the mortuary, state mortuary, we then undertakers then arrange that they collect the bodies as quick as possible. However, me as the member of the South African funeral practitioners, our members are quality checked per member if their mortuaries are in a good state. So we have members that belong to South African Funeral Practitioners Association. Their fridges are up to our standards. They are correct and good to serve the community.
Have you had to deal with state mortuaries at all, Mr. Mabindisa, and families perhaps that are collecting family members from state mortuaries?
Yeah, at some stage they become state mortuaries. They become overwhelmed with the bodies, and but however they collaborate. There's a communication line to say, let us collaborate and say how quick can we collect, tell the families to collect their bodies from them so that we can save and preserve the bodies to our mortuaries.
Prof, I bring you in here because you're quoted in this article as saying, and this shook me quite a bit, where you talk about it's an awful environment to identify a body in for a family. And we're speaking now about state mortuaries where only 62, again, we highlight, only 62 state mortuaries out of the 118 received certificates of competence. You're quoted as saying it's an awful environment to identify a body in. It should not smell like 10 cows have died in there because bodies are decomposing, because fridges have broken. So are you saying essentially, Prof, that going into the half of our state mortuaries, that is what it smells like?
Wow.
I'm not saying that it smells like that all the time. I'm saying that when we have a situation where fridges are not working optimally or have broken down, then there's an odor that hangs around a facility like that. So we don't take family members into fridges or into the actual autopsy suite components. They're not allowed there. But even it's quite a pervasive smell. So if there is a breakdown of a fridge, and you must also remember we receive bodies that are in a decomposed condition. Yes. And we have processes that we try and follow with these to minimize the odor that will emanate from those bodies. We have to do autopsies on those bodies, and they have to be stored in our facility. So we've got a joint component. We receive decomposed remains, and then we have refrigeration units that can break down and do break down from time to time. So it's an environment where odor needs to be controlled. And no matter how hard you try, it is an odor that spreads. So even when families come to administration offices, for example, where we do the identification processes with them, there can be this very overwhelming odor, and it's a very tough. It's a legal requirement that families have to identify their loved ones in a forensic pathology service environment. We have to be certain that the individual that we're going to be handing back to an undertaker has been appropriately identified.
Yeah.
So it's a legal script. They have to come and do an identification.
Okay.
And even if they do it digitally, the environment doesn't smell good at all times.
Yeah. Understandable, and thanks for clarifying that. Mr. Mabindisa, so then I bring you in here, because certainly we can say, all right, well, families have the option then of choosing not to make use of state mortuaries and go the route of going towards your private members, if you will. But load shedding, has that been a factor for the sector?
Yes, load shedding has been the factor, but remember that it is mandatory that if you have a private mortuary, you need to have a backup generator or a solar system. So it's been there before the ages of load shedding. So it's not something that is new to us, because of we've been dealing with mortuary remains in our premises. So we knew that it is mandatory that we have generators or backup thing. It's nothing that is new. That is why it is always preferred that you quickly use the private mortuaries as soon as possible. However, it's legal that if a person died of accidental death, they need to go through the state mortuary to perform autopsy and etc. We cannot take that body, even those that died in hospital. You need to identify them, and before you take them, the process. So the only bodies that we take directly are the ones that died in the house. We call them the house pickers. So after the pathologists, they came and certified the body dead, and there are no any other suspectable injuries. It's only natural death that they can rely on. Then they can call the private undertaker to come and collect the body at home.
And so then can we talk a little bit about what legal authorities, law enforcement authorities need to be dealing with as well? I mean, here's the reality. In a province like Gauteng, Prof, you've got, 7,700 murders that were committed. That's just in the last 3 months of 2023. I mean, that's a massive number. What then happens for where autopsies need to be conducted? I believe the numbers are we're conducting a maximum of about 1,800 in Gauteng, but we have a backlog. Your understanding of just how massive that backlog could be, not just in Gauteng, but certainly in other parts of the country, Prof.
So look, the figures that you are giving are the figures that were in that newspaper report, and I didn't provide those figures. Please let me clarify that, because I don't know where they got all of those figures from. But we do about 20,000 medico-legal death investigations in Gauteng now. It's gone up significantly. So nationally, around about 80,000, because we do about a quarter of what gets done in South Africa. And you've got to understand the context. We only do unnatural or suspected unnatural death investigations. And this is strictly legislative in South Africa. So any accidental, suicidal, homicidal, sudden, unexplained or suspicious death, and the procedure-related deaths must, by law, be admitted to a forensic pathology service medico-legal facility for a medico-legal death investigation. And the police must, by law, open dockets on these cases so that they can be investigated. So we don't have, there's no optional, we feel like doing it, or the family member feels like it. Right. This is what the law in South Africa states. These are cases that must be investigated. So whether we have a mass disaster like that building that caught fire in Johannesburg, that terrible tragedy last year, where suddenly you have 80 bodies on one day that have to be dealt with in an appropriate investigative and medico-legal manner and forensic investigative manner, we have to deal with them. And we do. We actually manage under the most appalling circumstances because of the attitudes of the people who work there. Right. They know the job must be done and they will do it. So we do get overwhelmed from time to time because we have huge numbers. But we have systems and, shall we say, disaster plans in place to deal with these kind of situations as best we can, and we do.
All right. And, of course, thank you so much for speaking to us. I think when we saw these numbers, 16 out of 118 mortuaries not getting a certificate of competence, it's important for us to have the conversation to remind our viewers that, authorities and certainly professionals doing their very best under difficult conditions to give their loved ones the most dignified of endings to their life. Thank you so much for speaking to us. That was Professor Jeanine Vellema, who is, of course, and General Secretary from the South African Funeral Practitioners Home, Mr. Vuyisile Mabindisa speaking to us there.